occupational therapist.
Nice to meet you.
Nice to meet you. We're going to head on back here.
Okay.
How are you feeling today?
I got a lot of neck and back pain, and it's just really.
So we're going to run a couple of different tests today. Your doctor, Dr. Blaylock, he's asked for what's called an FCE. So we're just going to do a couple of different tests kind of related to the problems that you've been having. And can you tell me about your job?
Well, I do maintenance at a hotel, and so sometimes I have to pick and lift a lot of things and really use tools.
Oh, okay. And so your neck pain, has it been bothering all that?
Yes.
Okay. That's what Dr. Blaylock's referral said. I just wanted to make sure real quick. Okay, so the first thing we're going to do is we are going to test your grip strength. We're going to do it 3 times on both sides, and we're going to go back and forth. So which one is your dominant hand?
My right.
And that's the one you've been having problems with?
Mm.
Okay, so first thing we're going to do is you're going to have your hand here like this, and you are just going to take and squeeze, 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 squeeze. Very good, awesome. So that is about 65 pounds. So that's wonderful. Let's go to the other side. Go ahead. Great. So that is about 60. Okay. Oh, that one went a little bit down. So that's about 40. That one went a little down too, so that's about 42. Okay, one more on each side, go ahead. Okay, that one's about 30, so we're going down a little bit. And that one's about 10. Okay, so the next thing we're going to do is we are going to test your pinch strength on both sides, just like we did grip strength. So what I want you to do is that you're just going to hold this down like this. I want you to have both fingers on top and your thumb on the bottom.
Okay.
Okay, awesome. So that's about 9. Other hand. That's about 16. Oh, we went down a little bit, so about 5. Wow. So that's about 17. It's about 6. And one more. So that's about 14. Okay, so the next thing we are going to do is we are going to walk over to my associate, and she's going to run a couple of tests real quick, just to test a couple of different things other than strength. Would you like a bottle of water by any chance?
Sure.
Okay, awesome.
Oh, thanks. Oh, thank you, dear.
You are more than welcome. Okay, we're going to come over here. I'm going to introduce you to Shelby. Hi, Miss Edith. How are you doing today?
Well, all right.
You having some neck pain?
Yes.
All right, well, we're going to sit down and we're going to do a little bit of activities. I've seen on your chart that you are a maintenance technician at a hotel, so I actually have some stuff that resembles that, and we're going to see what you can get done. Does that sound okay?
Okay.
All right, I'll have you have a seat right over here, and I'll be right over here. Have you seen any of this stuff before?
Oh, yeah.
All right, let me see if I can get this. I can't figure this out. Do you know how to get this undone?
Yeah, I should be able to.
Awesome. I didn't know it came off that way. Okay, so what I'm going to have you do is I'm going to have you place that bolt through here and then screw the nut back on and put a washer on for me. And then I really want you to use this crescent wrench to adjust it and then tighten it back up. Okay?
In the washer?
Yep.
Well, my hand just feels really weak right now. Maybe I should just try my hand.
Okay, can you pick that crescent wrench up for me?
Okay.
Let's try to tighten it a little bit more.
See, I just can't do my job like I used to.
There you go.
Oh, I think that's about all I can do.
Okay, we have finished up with this, and so we're going to go back over to Natalie and do a little bit more on our assessment today, and then we should be about finished. Does that sound okay?
Okay.
All right. How'd it go?
Well, I could do some of the things, but really that pain, it just keeps me from doing, the hard parts of the job, and sort of gripping or twisting. It just really hurts.
Okay. Well, I think we have a couple more questions just for our assessment today. Are you having any problems at home with showering or cleaning or anything using your hands?
Well, I do a lot of that stuff all by myself at home. I try to use my left hand.
Okay.
But, it's just not the same as when I work. It's
Okay.
just not as hard.
So there's just a big difference there.
Yeah.
Okay. Well, I think we're about done for today, so I'll go ahead and let you go.
Okay.
And we'll send this FEC to your doctor, and he will get back to you.
Okay, thank you.
So based on this therapy session, we have concluded that this is an example of an ethical dilemma. Edith, our patient, has documented that she has a disc herniation between the C7 and the T1 level, with the C8 nerve root being compromised, creating radiating pain down in her hand. She's been receiving therapy for the disc herniation, and the doctor states that she should be able to manage all the pain from therapy and should have no work limitations. The FCC that we've completed today exhibited the inconsistency with the results of the grip test and the pinch test, and there should be, she should have full functional ability in her right hand. So some background information on Edith. Edith is 70 years old. She cannot retire due to financial reasons. She has no family support, and she has been presented with a fake effort during the therapy session. She wants long-term disabilities, but is currently on short-term disability. Okay, for our case study, this model would be a Kawa model, which is the river, and the river represents life. The banks of the river would represent her work environment. The rocks or the challenges in her life would include bills, age, and pain, and no family. And the driftwood or assets of this model would include work and short-term disability.
So this Kawa river presents Edith's life and her life flow. So as we can see here, she does have some limitations, but she also has some assets and liabilities. But at the end of the day, she still has a pretty good flow to her river. So transitioning on over here, the frame of reference that we used is a biomechanical approach because we was talking and discussing her grip strength and the functionality of her grip strength and how she was able to use that in her place of employment, but also in her everyday life. And so our clinical reasoning here is ethical and narrative. Ethical approach that we made was because the occupational therapist had to present the truth in the documentation that Edith actually showed inconsistency with her performance in the assessments that were performed today. And then the narrative approach was because Edith actually presented to us with the concern that she did have financial issues. She had to work even though she was 70 years old. She wasn't able to retire and a couple other things. But at the end of the day, it's only the ethical way to present the truth in the documentation. So our adaptation approaches that we could present to Edith in therapy or just as occupational suggestions are going to part-time. So she presents to work full-time right now, and so
depending on her financial constraints and budgeting, she might be able to afford to only work part-time, which would actually be very helpful in her pain management. And then she could also have a change of position at her place of employment. Right now she is a mechanical technician, so she deals a lot with grip strength and maintenance and tools and things like that. So she could go to maybe an office job or doing like housekeeping, because she does work at a hotel. And then the next thing is in occupational therapy, skilled services could provide her with some pain management or a home exercise program to increase the strength, since we have a biomechanical approach, and really help her grip strength and overall functionality in her work and home environment. Lastly, we could have a handle modification to her tools. And so since she does have present to have a limited grip strength secondary to her herniated disc between her C7 and T1, tight grip may be compromised, but she did present to have an overall functional grip because she was able to open the door and open a bottle of water. So what we could do is put a wider handle on the tools that she uses and in her place of employment, and that would really help the functionality in her grip.